Hello Plus ambassadors. Welcome to the product training of Trimacare. What is the indication for this product? Preconception, pregnancy, and breastfeeding or lactation. Pregnancy is also called as gestation. Childbirth typically occurs around 40 weeks of gestational age. This is just over 9 months and is divided into 3 trimesters: Trimester 1, Trimester 2, and Trimester 3, each lasting 3 months. What is the potential market size for this product? 65,000 plus live pregnancies are reported per day in India. If you include preconception and lactation, this is probably the largest addressable market for any product in the gynae segment. What is a mother's need during preconception, pregnancy, and lactation? Nutrition is of utmost importance during preconception, pregnancy, and lactation. Nutrients are the building blocks of a human life. Nutrients are divided into 2 parts: macro and micro. Macronutrients include carbohydrates, fats, and proteins, and micronutrients include vitamins and minerals. Even though required in small doses, micronutrients help in all essential biochemical process. This table shows that each biochemical process requires multi-micronutrients for proper functioning. For example, folate alone is not necessary to increase fertility. Folate, as well as other micronutrients such as vitamin D, vitamin E, vitamin C, vitamin B6, zinc, omega-3 fatty acids, and selenium are also necessary for the same process. What is the current prescription practice as well as gaps? Doctors usually prescribe only iron, folate, and calcium during pregnancy. The trend of Indian gynecologist prescription is as follows: preconception to first trimester, folic acid 1 mg to 5 mg, second and third trimester, elemental iron 60 to 100 mg, and elemental calcium 500 mg. Sometimes they also prescribe vitamin D, vitamin B12, vitamin B6, omega-3, magnesium, and vitamin E, but in condition-specific women. Supplementing with iron, folate, and calcium alone is not sufficient because 1 in 2 pregnant women are micronutrient deficient. And it is called hidden hunger. Indian diet is carbohydrate rich but nutrient deficient, which leads to adverse pregnancy-related outcomes. Amongst Indian women, 43.8% are zinc deficient, 33 to 89 iron deficient, 27% vitamin A deficient, 80 to 90 vitamin D deficient, 26.3% folate deficient, 74% vitamin B12 deficient, and 33% iodine deficient. The government of India had run a health program on anemia in pregnant women, in which iron and folic acid tablets were given to all pregnant women who participated in the program. Despite the national level program, prevalence of anemia in Indian pregnant women did not come down significantly. As we discussed in the previous slide, that each biochemical process requires several micronutrients. Similarly, the RBC production process requires folic acid and iron along with other micronutrients. To treat anemia, various micronutrients are important apart from iron. India has one of the highest number of adverse pregnancy outcomes, such as miscarriages, low birth weight, small for gestational age. All are linked to micronutrient deficiencies. The second gap in present prescription practice: poor adherence to therapy. 40% pregnant women report poor adherence to therapy due to multiple pills. Taking separate pills for iron, folate, calcium, vitamin D, B12, pyridoxine, etc. is very difficult for a pregnant woman. What is the ideal solution for Indian pregnant women? The ideal solution is to provide multi-micronutrient tablets that also contain iron, folic acid, and calcium as per the nutritional requirement of pregnancy. It will provide one-stop solution and give freedom from multiple pills during pregnancy. Is there any market competition for this? There is no direct competition in the Indian market for multi-micronutrients that also contain IFC or iron, folic acid, and calcium. Current pregnancy market of India is only based on iron, folate, and calcium. There are a lot of multivitamin brands in the Indian market, but they do not contain optimum amount of iron, folate, and calcium. Therefore, they are just add-ons to the IFC practice, not a replacement. Plus Life Sciences is a pioneer in brining the ideal solution for Indian pregnant women and their needs. Introducing Trimacare prenatal tablets for healthy pregnancy. Trimacare is a multi-micronutrient, including IFC formulation. Trimacare contains 20+ micronutrients which are based on the guidelines of ICMR and WHO. In their latest guidelines, WHO, UNICEF and ICMR recommend multi-micronutrient, including IFC, model for a healthy pregnancy. As per research, MMN model is better than classical IFC model. MMN model provides better patient compliance, short-term and long-term benefits to both mother and child. The word Trimacare means trimester-wise care. Always emphasize on the etymology of the name to register a brand amongst customers. Trimacare is a 3-stage course. It is a unique, patent-applied formulation designed for each trimester of pregnancy. Trimacare 1 for first trimester, Trimacare 2 for second trimester, and Trimacare 3 for third trimester of pregnancy. Let's discuss Trimacare in detail. Trimacare 1 provides all nutritional requirements for preconception to first trimester of pregnancy. Dosage: 1 tablet per day. It has L-methylfolate and omega-3 for brain and spine support, pyridoxine and antiemetic blend to reduce morning sickness common in the first trimester of pregnancy, vitamin D, vitamin B12, iodine and other 20+ micronutrients. Trimacare 1 contains the following micronutrients as per RDA or required daily allowances, defined by ICMR. Trimacare 2 provides all nutritional requirements for second trimester of pregnancy. Dosage: 2 tablets per day, 1 in the morning and 1 in the evening. Note: Trimacare 2 package has 2 different tablets. Morning tablet is with iron component and other micronutrients, and evening tablet with calcium component, along with vitamin D and magnesium. Morning pills contain iron as ferrous ascorbate with advanced time-release formulation, which allows for better absorption and less GI side effects, along with various multi-micronutrients. Morning tablet also contains vitamin C, which helps with absorption of iron. The evening tablet contains right combination of calcium and vitamin D such that it does not leave a metallic or chalky taste in the mouth. Trimacare 2 contains the following micronutrients as per RDA defined by ICMR. Similarly, Trimacare 3 provides all nutritional requirements for third trimester of pregnancy. Dosage: 2 tablets per day, 1 in the morning and 1 in the evening. In the evening tablet, magnesium content has been increased for prevention of leg cramps and preeclampsia commonly found in the third trimester. The bowel regulator has also been added, as most women complain of constipation during their third trimester. Vitamin K in Trimacare 3 helps in reducing excessive blood loss at the time of delivery. Trimacare 3 contains the following micronutrients as per RDA defined by ICMR. Now, let's discuss some of the unique components of Trimacare range. Vitamin B9 or folate in the form of L-methylfolate. Trimacare contains L-methylfolate, which is an active form of folic acid and 7 times more bioavailable than folic acid. Our body absorbs only L-methylfolate. If we take folic acid supplement, it converts folic acid to L-methylfolate. However, 40 to 60% of people have MTHFR polymorphisms. They can't convert folic acid to L-methylfolate. Thus, folate supplement in the form of L-methylfolate gets absorbed even if there is gene mutation in the pregnant female. What are the benefits? L-methylfolate enhances women fertility and helps in expansion of the uterus. It helps in RBC and DNA synthesis, maternal cell growth, fetal neural tube development, and prevention of birth defects. iron in the form of ferrous ascorbate as time release. Did you know? Human body absorbs only 12 to 15 milligrams of iron at one time. When you supplement with a higher dose, extra deposit in small intestine causes constipation. Therefore, it's very difficult for women to take high-dose iron supplements. Trimacare 2 and 3 contain an advanced iron formulation. Salt, ferrous ascorbate 60 milligrams, is released in small doses. Time release pattern is based on 4 packets of 40% plus 20% plus 20% plus 20% salt, released in total of 8 hours after consumption. This method allows for better absorption and less GI side effects. Calcium as calcium carbonate, and vitamin D2. A vegetarian source of vitamin D as compared to vitamin D3. RDA for calcium in pregnant women is 1000 milligrams, but body absorbs only 500 milligrams at one time. Trimacare has 500 milligrams elemental calcium. Milk, curd, wheat, rice and other ingredients provide the rest. RDA for vitamin D is 600 IU. Both RCOG and ACOG advocate routine for 100 IU vitamin D through supplementation. Trimacare has right combination of calcium with vitamin D. Metallic taste of calcium during pregnancy dysgeusia is one of the main discomforts. Trimacare does not leave a metallic or chalky aftertaste. What are the benefits? Calcium maintains parathyroid hormone PTH levels, reduces the risk of preeclampsia and preterm birth, and it is essential for bone development. Vitamin D supports optimal absorption of calcium, reduces the risk of gestational diabetes, reduces the risk of preeclampsia and preterm birth, and lowers the risk of intrauterine infection. Vitamin B12 and B complex. Vitamin B complex in Trimacare meets 100% RDA. B vitamins are water-soluble. If received through diet, extra will be easily eliminated from the body. Vitamin B complex is crucial to normal neurologic function. It helps in red blood cell production, DNA synthesis, energy production. Maternal vitamin B12 status in pregnancy influences cognitive function of the offspring. Omega-3 fatty acids. Trimacare contains a vegetarian source of omega-3 fatty acid in the golden ratio of 2:3 EPA. DHA. Fish consume omega from algae. Omega-3 in Trimacare is directly extracted from deep-sea algae, thus making it a vegetarian source. Omega-3 stimulates neural tube formation, prevents placentation disorders. It helps in fetal central nervous system growth, brain development, and preventing preterm birth. Vitamin A. RDA for vitamin A is 900 microgram retinol and 6,400 microgram beta-carotene. Trimacare contains 800 microgram retinol and 800 microgram beta-carotene. Remember, high level of vitamin A is teratogenic to fetus, but low level is essential during pregnancy. Vitamin A assists conception, implantation, placentation, and regular fetal growth, and maintains ocular integrity. Vitamin B6 or pyridoxine and anti-nausea blend. Trimacare has vitamin B6 as 100% RDA. In the first trimester, most pregnant women suffer from NVP, so they are usually given 10 mg pyridoxine. Trimacare 1 already contains 10 mg vitamin B6 with a proprietary antiemetic, anti-nausea blend, which is effective for mild to moderate NVP as compared to vitamin B6 alone. Antiemetic, anti-nausea blend is primarily a ginger lemon extract. Pyridoxine also helps in fertility and is a known mood modulator. Magnesium. Preeclampsia occurs in 2% to 8% of pregnancies and is responsible for the death of 63,000 women in India every year. Magnesium plays an important role in over 600 enzymatic reactions. It can influence fetal programming and disease presentation in childhood or adulthood. In Trimacare 3, 100% RDA of magnesium helps in reducing incidence of leg cramps, risk of preeclampsia, and IUGR. Iodine. RDA for iodine is 250 micrograms, but body absorbs only 200 micrograms at one time. Trimacare contains 200 microgram of iodine. Iodine levels are too low among pregnant women in India. It contributes in production and function of thyroid hormones in pregnant women, regulates the calcium homeostasis, and plays an important role in brain and nervous system development. Most gynecologists agree that it's very important to supplement with iodine, especially in the first trimester. Bowel regulator. Trimacare 3 evening tablet contains bowel regulator. It provides reliefs from maternal constipation and prevents from hemorrhoids. Bowel regulator contains whole lignans, Feniculum vulgar, Senna alexandrina, Zingiber officinale, and Cuminum cyminum. How does Trimacare work for the benefit of the mother and the child? Do you know the concept of the first 1,000 days of life? The first 1,000 days of human life are the most crucial days of life and termed as the window of opportunity. Proper nutrition in first 1,000 days lays the foundation of lifelong health for the baby and also for future life of the mother. First 1,000 days begin from conception. They comprise 270 days of pregnancy, 180 days of lactation, and 550 days of infancy. Multi-micronutrients supplementation in first 270 days of pregnancy plus 180 days of lactation equals 450 days out of 1,000 days is completely in the hands of the gynecologist. MMN supplementation provides short-term as well as long-term benefits to mother as well as the baby. It reduces the risk of preterm birth by 55%, preeclampsia by 45%, low birth weight by 15%, small for gestational age by 7%. See this figure to further understand the short-term benefits. See this figure to understand the long-term benefits. Packaging of Trimacare range. Trimacare range comes in two types of packaging: bottle for 1 month therapy and strips for 7 days therapy. Trimacare has a very attractive and premium packaging. See the table for details. Manufacturing. Trimacare is manufactured by Deccan Healthcare. The manufacturing unit is FDA approved, GMP certified. For your information, brand A to Z is also manufactured at the same plant. Trimacare has a 2 years expiry. What is the cost of Trimacare? In this table, PTS, PTR, and MRP of all SKU of Trimacare is described. Note, cost of Trimacare 1 therapy is 20 rupees per day. Trimacare 2 and Trimacare 3 is 30 rupees per day, including both morning and evening tablets. As shown in this table, Trimacare is more cost-effective than buying separate pills. At the same time, it also provides more number of essential micronutrients, including omega. Finally, how is Trimacare beneficial to the end customer or a pregnant woman? Trimacare provides all micronutrients required by both mother and child in each trimester of pregnancy. Not only it's beneficial for growth and development, it also reduces maternal discomfort like morning sickness, fatigue, constipation, leg cramps, preeclampsia, gestational diabetes, etc. As a one-stop solution, it is easy to consume. Advanced salts and time-release formulation reduces GI side effects. It's vegetarian. Which are the unique selling points for our customer? Dear doctor, upgrade your clinical practice. Trimacare is an advanced formulation with WHO recommended multi-micronutrient including IFC model. Patent applied, Trimacare is a unique concept. It is 3-stage course to fulfill the needs of each trimester of pregnancy. You hold the key to the first 1,000 days of life. First 1,000 days of life is a window of opportunity for you to lay the foundation of good health. First 1,000 days of life begin with Trimacare. With Trimacare, you will experience a better patient compliance. It is one-stop solution. It gives less GI side effects as compared to regular iron calcium tablets. And it's completely vegetarian. Trimacare comes in a premium, attractive package. Trimacare in a nutshell. Indications. Need. Formulation. Dosage. Benefit to patients. USB. Cost of therapy. Don't hesitate to demand 1 prescription per day. Friends, thank you for your time and attention. Remember, Trimacare is the flagship brand of Plus Life Sciences.